Thank you all for joining us today for another episode of our podcast, Moving to Value Unscripted. My name is Dr. John Rodas, and I'm a recovering ex-hospital president and am proud to be the president of the Moving to Value Alliance. The Moving to Value Alliance, MTVA, a 501c3 nonprofit, is a multi-stakeholder grassroots organization whose purpose, put simply, is to foster a community that aims to create a value-based healthcare ecosystem with high-quality outcomes at a reasonable cost for plan sponsors and their members, beneficiaries, or employees. Our community has grown substantially over the past few years. We started in Connecticut, but now have nearly 1,000 stakeholders from more than 40 states all over the U.S. We want to thank our members who make this presentation possible. We'd like to give special recognition today to our trade member, Capital RX. I'm joined today by my fellow board members, Lisa Trumbull and Dr. Steve Schutzer. Lisa Trumbull is the CEO of Sohn Health, Southern New England Healthcare Organization, a physician-led, clinically integrated delivery system in Connecticut and Massachusetts. Dr. Steve Schutzer, a nationally renowned arthroplasty surgeon, is one of the founders of MTVA and is the co-founder and president of Upswing Health. Our special guest today is Dr. Elizabeth Boham. Dr. Boham is board certified in family medicine and is the medical director of the UltraWellness Center in Lenox, Massachusetts. Dr. Boham is also a registered dietitian, and she practiced nutrition in New York City before going to medical school. Dr. Boham uses her background in nutrition to help patients improve their health and manage disease, including insulin resistance, metabolic syndrome, diabetes, autoimmune conditions, and obesity. She's on the faculty of the Institute for Functional Medicine and has developed a functional nutrition course that is being used to educate physicians and other health professionals worldwide. She also wrote a chapter on the functional medicine approach for obesity for the 9th edition of the Rankel Textbook of Family Medicine. Dr. Boham experienced firsthand how difficult it can be to navigate the healthcare system after being diagnosed with breast cancer at the age of 30. We're excited to have Dr. Boham here today to share her experience with functional medicine and discuss how principles of functional medicine can help achieve better outcomes for patients. Welcome to Moving to Value Unscripted, Dr. Boham.
Oh, thank you. Thank you both and all of you for having me. It's really wonderful to be with you and your audience. So it's great to be here. Yay.
So, Elizabeth, if you could, for our listeners, could you tell us a little bit about how you went from, studying nutrition at Cornell to becoming a functional medicine physician? Just share with us a little bit about your journey.
Oh, absolutely. So, as you mentioned, John, thank you. My undergraduate and graduate degree was in nutrition and exercise physiology. And, I was all about prevention, and that was kind of what really excited me. When I decided to go back to medical school, my intention was I was like, okay, I want to learn more about how the body functions and what we can do to stay well and how we can help treat the systems in the body and understand how the body works. And then, I went through the medical school process and I really didn't know what I was getting into. And everybody in my family are PhD doctors, not MD doctors. And so I really didn't have a good sense of what it meant to be a physician. And where I struggled was the focus on acute care medicine. And though at this point, especially after having a disease where I needed really good acute care medicine, which I got, I appreciate how well we do acute care medicine. I was frustrated by, how we were using that model to treat our patients with chronic diseases. And there was a lack of focus on prevention and a lack of focus on lifestyle. And I was really frustrated by the lack of time I got with my patients. When I was doing primary care, so I'm board certified in family medicine, I was, those frustrations were coming up and I was like, I need to do this a different way. And I was really lucky. I ended up in 2004 going to a conference that was put on by the Institute for Functional Medicine. And it was like this aha moment where I was like, okay, this makes really a lot of sense to me because functional medicine, the Institute for Functional Medicine, which has been a leader in training physicians and practitioners in using functional medicine for 30 plus years, it really gave me the tools. It gave me this way of organizing my thought process and integrating my nutrition background, my exercise physiology background, along with my medical school training and thinking about health and disease in a different way that just made a lot of sense to me. So as opposed to an acute care model of medicine, which again works really well in acute care, we're like, okay, we've got to name the disease and then figure out what we need to do to suppress the symptom right away or treat it right away or what pharmaceutical we need to use or what surgery we need to use. But with chronic disease management, that process, that way of thinking about things, I don't think works as well. And it results in our patients being frustrated, physicians being frustrated. And I was frustrated by the lack of time I had with patients. And so that's when I started learning about functional medicine and incorporating that into my practice. And it's really a fun way to practice medicine. And in addition, it really can be a much more powerful way of practicing medicine where you're looking for that underlying root cause, asking that question why, seeing what's out of balance in that person's body, working to remove things that may be causing this imbalance and replace things that are missing. It really helped the body get in a position where it can heal. And so it's really just been a fun journey for me. And I really enjoy practicing functional medicine and teaching about functional medicine.
Wow. What a story. It's very interesting hearing you now say that your family were PhDs. I get a mindset that they were scientists and researchers and looked at data. Now I can understand a little bit more why you navigated this for yourself. But I noticed that you have studied nutritional biochemistry. What is that about? I mean, I did, PChem and OChem in college. What is nutritional biochemistry?
So it's looking to see how biochemically nutrients impact the body. And everything from, you think about how the vitamins and minerals are cofactors in so many different processes in our body that are going on all day long, right? So, you think about our mitochondria, right? And you need B vitamins and CoQ10 for our mitochondria to work properly so food can get turned into energy. Every process that's going on in our body, for our body to take T4, thyroid hormone, and turn it into the active T3, we need things like iodine, we need iron, so what nutritional biochemistry really focuses on is how nutrients are used as cofactors in all the millions of chemical reactions that are happening in our body all day long.
It's all chemistry, right?
Yeah. And so it's like, it just reminds us when you really focus on the power of nutrition, I think it helps us all realize how important it is. You guys both understand this as surgeons, right? When you have a patient who is malnourished and people think, well, we're in the US, how much malnutrition do we have? We have so much malnutrition, and especially nutritional insufficiencies, which may not be as significant as deficiencies, but still are impacting how our patients are healing. And so, if you have somebody who's not getting adequate protein, or maybe they're not digesting and absorbing their protein adequately, so their amino acids in their body are low, or they're low in zinc or iron, like that really impacts how they heal after surgery and how well their body can rebound. Or, you take this epidemic we have of metabolic syndrome, right? Where there's such a huge portion of the population that are walking around with blood sugars that are a little too high and insulin that's a little too high. And again, if you just go to surgery and healing, or even just fighting infection, we know that how significant that is in terms of how well the body functions and how well it can heal after surgery, or how it does after getting an infection, right? We saw with COVID how significant it was when people have metabolic syndrome, how much worse they did when they got COVID. And we see that with every infection, right? So when I was doing TPN in the ICU, right, we were so focused on making sure blood sugars were balanced, because if they weren't balanced, then people didn't fight off the infection as well. And so, I think it's important that we think about nutrition every minute, every day. You asked me a question, Steve, about nutrition. I could go on for hours.
Oh, no,
No,
this is
no, but
great.
you make the
Kind of
distinction.
embarrassing sometimes.
No, no.
We have, and you make a distinction, nuanced distinction between we have an obesity epidemic, but at the same time, a malnutrition epidemic that's
Yeah.
underappreciated, underdiagnosed, and I think that's a critical point. Help me understand. So, as you know, and we talked in our pre-call, I became a diplomat at the American College of Lifestyle Medicine, and for our listeners, and I think you've kind of hinted at it already. It sounds like it's a little more upstream, if you will, in the disease process. The difference, so I learned the value of stress and sleep, and
Yep.
and smoking and not drinking, and exercise, and particularly food as medicine, and particularly a whole food, plant-based diet. So I learned the value of that. Tell me where functional medicine is distinct and different from that.
Absolutely. So, it's really just a way of thinking about the body and how we attack a patient. I guess attack is the right word, but think about their health. And, definitely functional medicine focuses on lifestyle medicine, right? That is the foundation of the matrix. And the matrix is a tool that we use in functional medicine just to organize our thoughts around a patient. So we know that our lifestyle, our sleep, our stress, our nutrition, our exercise, our community really is the basis of good health. But functional medicine goes, it does more than just lifestyle medicine, right? It's looking for that underlying root cause, asking that question why. And it doesn't mean that we can always figure out what the underlying root cause is. And many times there's multiple things coming together that's influencing the body's health, but it's at least asking that question why, as opposed to just focused on, in conventional medicine, a lot of times we're focused on, okay, we're going to name the disease and then use a specific medication to suppress those symptoms, right? It's asking that question why and understanding and personalizing our recommendations. So for example, if you had 10 people with depression, you may have 10 different reasons for why these people have depression. So it's not necessarily like they all need an SSRI, and it doesn't mean that an SSRI wouldn't be helpful for some of them, but we all recognize that, the SSRI medication is only so good, right? It's only helping like half of the people some of the time, right? So when we ask that question why, we can figure out for that person or work to figure out what is out of balance in their individual body. So we know, for example, depression can be caused by inflammation in the body. And, well, why would there be inflammation, right? Chronic infections, gingivitis, gut infections, poor diet. Of course, diet is impacting inflammation. It's also impacting, nutritional insufficiencies and deficiencies, right? So if somebody is low in omega-3 fats or vitamin D or the B vitamins, of course, that can impact their mood. If their lifestyle is out of balance, that, of course, not getting enough sleep, not exercising enough. But we even know things like imbalances in the microbiome are impacting our mood. And so really functional medicine is asking that question why, looking upstream, personalizing the recommendations for that individual patient. And it's very science-based, So I think that, trying to use the latest science as much as we can and appreciating, all aspects of somebody's health. But to do all that, right, we need the time to get to know our patients and to understand their history and where they're coming from and understand their timeline, understand their, what we'll call the antecedents, triggers, and mediators, right? Those things that predispose them to what's going on, the things that may have triggered or pushed their body over the edge, those things that are continuing to allow that imbalance to go on in their body. So we need the time to kind of explore that with patients. And so it's I think a lot of times physicians are frustrated with the current model because they don't have the time to get to know their patients. And so they don't have the time to really make some good changes that can help our patients do so much better, or even figure out what motivates them and why they're doing what they're doing or not doing what they know would be better for them. We know that 90% of our chronic diseases are food related, right? But we're not training our physicians in the power of food as medicine, right? And so physicians don't think to say or to refer to a nutritionist, or we're not reimbursing nutrition care. I mean, there's a lot of issues there, right?
Well, I'm sure Lisa could comment on that, but I think the SON, when I look at the SON health physicians, my daughter actually is a nurse practitioner in there. She has actually some time. She doesn't have to see, 30 patients a day. She can see, 14 in a day and spend the time with them. And to your point, and her patients, every week she says to me, a patient says to me, "You've changed my life. I'm exercising. I've changed my diet. I'm losing weight. I'm off these meds and yada, yada." And I'm
Yeah.
like, and I stopped smoking. And I'm like, wait a minute. Most of us spend our whole freaking career doing that. And nobody changes anything. She goes, well, I spend time with the patient. And she's knowledgeable enough to ask, what'd you eat last night? What'd you eat this morning? Just a simple thing.
Simple.
And just then let me tie that into part of what you do from an education point of view. You studied nutrition before you went to medical school. Then you went to medical school. Comment on how much nutrition you learned in medical school and point out I think doctors don't even ask people what did they eat last night. because they're afraid to know the answer because they don't really know what to say. Now, I know it's a big, broad brush I'm painting with, but how much truth is there to that?
I think it's very true. The National Academy of Sciences has been recommending that physicians get at least 25 hours of nutrition education in medical school since the 1980s. And only about less than a third of medical schools meet that minimum requirement. I think on average, medical students get 20 or so hours of nutrition education. And, over half of medical schools are even less than that, right? And so I think you're right about I think sometimes physicians are scared because they don't know if it's just going to take more time and they don't have the time in their schedule, right? So it's part of that. And then also, as we know, nutrition can be complicated, even though it's so easy. And we've made it complicated, even though it's so easy, right? And so sometimes there's a lot of questions and, that take people, just takes more time to kind of uncover and investigate. But they've done some research, they were studying cardiologists. And we know that so much of chronic diseases that people are going to cardiologists for are diet related. At least a huge portion are diet related, right? And everybody would agree on that. But they noticed that only 10% of cardiologists are referring to nutritionists. And they said, well, if we just give a little bit more nutrition education in training, we can double that. And so it's not like we're going to make physicians nutritionists, but if we can remember and highlight the importance of nutrition in terms of healing, chronic disease prevention, chronic disease reversal, overall health and well-being, that can make a huge difference in terms of referrals to nutritionists and just even those things that you mentioned that your daughter is doing, those things that you're just bringing it up.
And to be fair, she then refers to the nutritionist. She's not sitting there doing all that because she has to move on. Lisa?
Yes, Dr. Boham, you're such a breath of fresh air to listen to. And I'm interested in how you see the world of population health and functional medicine integrating. And what do you think providers can do, a couple easy steps that they could do to start thinking this way and integrating it into the way that they're caring for patients so that it's more impactful?
Yeah, absolutely. So, I think that really functional medicine is just good medicine, right? Is what I was saying earlier. It is made to work alongside of how we are trained in conventional medicine and to just encourage us to ask those questions, why? So I think that's a great place to start, is to just say, okay, well, why is this going on? And for example, if somebody is, as I was mentioning before about depression, and just asking that question why and saying, okay, where is this coming from? Are they getting enough protein in their diet? Are they digesting and assimilating it enough? And, because sometimes that can have a huge impact on somebody's mood. I think that the training in functional medicine is great for all practitioners to look into. It can help sort of make more sense of this and demystify it a little bit and say, okay, how can I start to incorporate this into how I practice medicine? And, even just asking those simple questions of, well, what's going on with your diet? Do you need more support? Functional medicine has done some research in terms of how their model can help improve healthcare. And so at Cleveland Clinic, they have a Center for Functional Medicine, and they've done some research showing that when they've incorporated a group model where they've been able to patients come together as a group and then they have education, and you can use some like a health coach or a nutritionist to help the physician to provide some of these group visits in some way. That can help patients do much better and be more successful in terms of the things that you're asking them to do or integrate. When you say, okay, let's change your diet. Well, that takes a lot more than just making that recommendation. And so I think things like group visits can be something that can be incorporated. And I think that, when you go upstream in terms of thinking about this question of why is somebody not well, or you bring it to that question you asked about population health, there's a lot we need to do on a policy level to improve our food system and the food that we're giving people and the food that we're providing for our children. And, what is it? 65% of the diet in the US is ultra processed food, which is full of added sugar and food coloring and additives. And we're giving that a lot to our kids in school. And then expecting them to be able to focus and learn at school, when they start their day with cereals that have food coloring in it and yogurts that have added sugar to it, or even milks with added sugar to it, and then expecting our kids to be able to focus and perform well. I think functional medicine is really focused on impacting public health and population health as well. Yeah.
Yeah,
Wow.
agreed.
Yep. It's interesting. I do a response. I want to pivot over to policy, but before I do, I want to ask you a scientific question. And I'll confess, I did a little preparation, John, Elisa. I just had to. I did. So,
Shame on you. Preparing? Come on.
no, well, at least I'm honest. I'm confessing that I did a little preparation.
It's MTVA unscripted, which
I know. Well, the unscripted, the questions were unscripted, but anyway, I'm just being honest. But I do recall that when I was in college, I learned Mendelian genetics, and I learned that 80% of our health is predetermined. Good luck, you got your genes, you got stuck with them, and 20% may be environmental and so related. But that's always been my framework. You kind of got what you got. But now functional medicine is showing you some ability to reverse some chronic conditions and actually have it down-regulate genetic material. Is that true?
Well, we're learning more and more, right, about epigenetics every day, and right is how our genes are expressed and how much we can influence the expression of our genes, which is just fascinating. Even just to give a simple example of how our genetic expression shifts and changes. Going back to nutrition here, because I love talking about nutrition, but like the Dutch famine, right? So I don't know if I can tell you what years there was, but there was a famine. They were able to see that children born during the Dutch famine had a higher rate of obesity. And we see this all the time, even today. Children that are born, if their mother doesn't eat enough food during pregnancy, if they're born small for gestational age, their risk of obesity is much higher. Well, that is epigenetics. That is epigenetics explained, I think, right? It's saying that when you are being born during a time of stress, your genetics change, and they can show that you become more insulin resistant. Your risk for becoming insulin resistant increases. So your genetic expression officially changes. And there's even been research, especially like within mice, to show that can be multi-generational impacts, which is fascinating, right? So where we know lifestyle is so impactful is in the expression of our genes. We thought when we sequenced the genome, we would have had it all figured out. And then we just realized we don't know anything, right. Which I think is true, right? The more we learn, the less we know. And so that's really where I think where lifestyle can be so powerful. We know we can change the expression of our genes if we're under stress. We know we can change the expression of our genes if we're getting good sleep. We know that we can change the expression of our genes with every lifestyle choice we make every day.
It's interesting. Steve's question brings back memories because I majored in biology, concentrated in genetics.
Uh-huh.
And I was taught kind of like Steve alluded to. And then years after my maternal fetal medicine fellowship, I actually did another fellowship in clinical genetics. And clearly already by then, they started realizing, wait a minute, it's not that simple. It's not just, you have the genes, but you still need the environment to turn the genes on and off, to your point. And Warner showed this 40 years ago now. I can't even remember how long ago. Warner showed it with prostate cancer, how you can turn on and off these proto-oncogenes and the tumor suppressor cells. So that makes, because think about it, we have mutations occurring in our body every day, but we all don't get cancer. Some of us do, and I understand that. But where's the imbalance there? Where the tumor suppressor cells are knocking these things out all day long, right? There's DNA repair going on all day long. Well, sometimes it goes awry, right? So, and he was criticized then because, it was a small study and yada yada. Well, I think it's been proven now time and time again, to your point.
Absolutely. They show this a lot with food, right? That's why we keep talking about the cruciferous vegetables, broccoli, cauliflower, cabbage, kale, because they can impact the tumor suppressor gene expression, and even green tea, right? That's where they're power lies, or some of their power lies.
By the way, Elizabeth, the Dutch famine was when German occupied Netherlands towards the end of World War II. And I've studied them myself as well because, interestingly, the countrywide mortality, even though I think the average caloric intake they said was, I think, 600 calories per day or less for the people there, the countrywide mortality dropped 1%. Just
Right.
think about it. So even though people were starving, the mortality rates dropped. So again, going back to this whole thing of food excess, especially the wrong food excess. Now,
Yeah.
but the epigenetics part is the next part, right? You said the fetuses that were growing up in that environment were basically being starved, said, oh, I got to do everything I can to hang on to nutrition. And they became obese later in life. So it really was fascinating.
Yeah, I think when you were mentioning, John, about food insecurity, right? We know that food insecurity can increase risk of obesity, and it seems backwards.
Right.
But so much, research has shown that because when there's food insecurity, then people are reaching for the wrong foods that are high in calories, but really low in nutritive value. And so that really drives obesity as well.
Yeah. This is maybe tilting a little bit into the policy aspects of it, but last week we had a guest, Al Lewis, who talked a lot about food labels and how food labels are misleading, and Americans are thinking they're drinking something, 0 calories, zero sugar, and what they're drinking is worse than if they had 0 calories, zero sugar. And the concept of food as medicine. What do you think are the one or two policy changes that you believe would be helpful?
Yeah, I think Mark Hyman's done a lot of good work in this area with his Food Fix campaign, which has been really impressive. And one of the things I think would make the biggest difference is not subsidizing corn, soy, and wheat. We're subsidizing the wrong foods. Like we started subsidizing these foods just to make sure everybody had enough food, but we're still subsidizing those three big crops. And as you can see when you drive around, that's one of the reasons why you see so much corn. So as a result, then food industry has just taken these, they are very cheap foods now that are grown with a lot of chemicals and pesticides, and we grow lots and lots of them, and then they need to be used for something. So we use a lot of the corn, right, to make high fructose corn syrup, or to feed our cattle, which maybe shouldn't be eating all that corn, or probably shouldn't be eating all that corn, right? We have essentially subsidized unhealthy foods in a way, and that's why it can be so much cheaper to buy a can of soda than a bottle of water. And not saying that we want to be buying bottles of water, but that highly processed, ultra processed food is very inexpensive. And so I think that's probably one of the biggest things we need to shift from a policy perspective.
Yeah, I think that's interesting because, I think all of us have heard trying to eat a healthy diet means walking around the perimeter of the supermarket, but that's where the most expensive things are, right? Your proteins, your vegetables, and reasonable dairy products and stuff like that. And they're the most expensive things for people to buy. And the people that need them the most, the ones that, I'm not a doctor, and certainly can't dabble in the genetics in the way that you all do. But if you are able to really manipulate your outcomes of your own body in some way, shape, or form by eating more healthily, you need to have the ability to afford to do that. And it comes down to the same thing with like school food programs, right? Getting healthy products into school foods is more expensive than putting the cheaper stuff in.
That's because we are focused on the cost per calorie. And there's been a lot of research to show this. Yes, cost per calorie, it is cheaper to buy soda or Fruit Loops than salmon, right? But cost per nutrient, absolutely not. And there's a lot of research to show this. If you look at, if we need to get people this amount of zinc per day, right, in their diet, to get that amount of zinc through processed food versus whole foods, it is cheaper to get it through whole foods. And so people are focused on cost per calorie, but the research shows that if we focus on cost per nutrient, absolutely not. And so what has happened is we've just gotten obese and malnourished because we're focused on cheap, inexpensive food, and we don't need that at all. So we don't need more food, we need better food. So yes, people say, well, it's the expensive way to eat, blah, 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 but we are just costing our healthcare system tons and tons and tons of money because
Got
we
it.
are subsidizing unhealthy food without a lot of nutrients that can't then support all of that nutritional biochemistry that we were talking about earlier all day long, right? So,
Right.
Yeah. Yeah. Again, under the category, I peeked a little bit under the hood. I looked up what are the downsides of functional medicine and what are the disadvantages. They had several of them, which one of them was lack of scientific evidence. Having just finished Marty McCary's book about blind spots, we mentioned that the other day in our pre-call. Come on now, lack of scientific evidence. But one was cost. But when
yeah.
I looked a little deeper, the average American pays about $1,300 in pharmaceutical bills every year, right? Out of pocket. And not to mention the unnecessary heart surgeries and all of that sort of stuff. So that actually, thinking the way you just, the cost per nutrient actually makes economic sense in the current world today when people are paying more out of pocket. It's not a
Yeah.
great thing, but we're paying more out of pocket anyhow. Might as well pay for something good.
Yeah, the way that we're incentivized to practice medicine based on by reimbursement, right? So that has resulted in more procedures, more pharmaceuticals, and less time with our patients, right? So that has to change. If we just shifted it, most physicians know this. If they had more time and they know that lifestyle matters and helping our patients change matters. But if you don't have enough time, then you go, okay, what do I have time to do? Well, I can write for this prescription. And then a lot of times patients are dissatisfied too, right?
I remember as a resident in surgery, but probably the same in family medicine and GYN, we had the term treat them and street them. Get them in, get them out, right? That's inculcated in our mindset.
And the cost, I love that cost per nutrient concept.
Yeah.
That's right. You know, pay me now or pay me later. At the end of the day, we pay for these chronic diseases, and we all know this numbers, right? Everybody talks about the top 5% of this pyramid is more than half of the total spend, which is 4.5 trillion now. And I just read something the other day, it's going to be 7 trillion within the next 10 years. It's
Yeah.
it's not sustainable. But of course, it gets muddled about who's really paying that. But all of us are paying, right, through either whether it's heart premiums or co-pays that Steve was alluding to, or deductibles, or taxes if we're Medicaid, or taxes for Medicare. We're all paying, and the subsidies to farmers, to your point. We pay to people to grow corn. So guess what? They grow corn, and there's so much freaking corn, which then feeds the fish in the farms, feeds the chickens in the farms, feeds the cows. So when you're eating all those things, you're really just eating the GMO corn at the end of the day. And you're not really getting, even though you may think you're eating healthy, you're still not, even when you're doing that. I keep thinking of Ben Franklin here would be, I'm sure it's rolling over his grave for multiple reasons, but when he thought about an ounce of prevention is worth a pound of cure, and he was talking about fires at the time, home fires. But I think the metaphor with fire and what's going on in our healthcare system is not bad. It's like a fire that is going unabated right now that we haven't really even begun to tackle.
And I think physicians are there's so many that are dissatisfied, and obviously you guys have spoken a lot about this, but so many people are leaving primary care because of it, because of all these dissatisfactions. There's so many. And we're also, I think, physicians sometimes don't have the time or the energy to stand up and say we've got to do this differently, because they've just kind of gotten into this process, and then they teach us in medical school how not to take care of ourselves, because that's kind of taught out of you, and then you just kind of go. And I think it's also really important for the health of our physicians to be shifting the way that we're doing things and recognizing it's not, they're not satisfied either. And that's why so many have come through the Institute for Functional Medicine for training, because they're like, I've got to do this differently. We've got to figure out how to do this differently. And I think that's what draws people to that training. And they get excited. Okay, now I have some more tools in my toolbox to use. I can start to think about this a little differently with my patients. And I think that's why a lot of people come for that. And I think what we need to do in the future is just work on how to integrate that into all of medicine, and how just shifting how we practice medicine.
Yeah, I think one of the other things as I was listening to you, it's so complicated, right? Nutrition's so complicated that and I'm thinking more from a layperson perspective than someone that's gone through medical school that might know a little bit more about how the body works and how it absorbs nutrients and the like. And I remember growing up, we all are probably in the same age range where we all learned about the food pyramid and all the good things to eat and the bad things to eat and to stay away from. And like all of those life skills have been cut out of education for our young people these days. And they end up graduating high school not knowing anything about economics, nothing about nutrition, nothing about how to like cook or take care of themselves. And we've done them a disservice because then they go forth and they learn a couple of things on the news or on social media, like eat this and everything's going to be better because everybody wants a quick fix. But they didn't get the baseline education to begin with to understand. And I'm wondering if, from a policy perspective, you see any benefits to reintroducing that type of education at a primary level, because we need to treat the obesity in our country as an epidemic, even though it's been talked about a lot. Very little has actually happened, right, to change behavior.
Yeah, 100%. I mean, I think the number one thing that you said that I want to reiterate is just the importance of teaching kids how to cook. And we know that when we cook for ourselves, when we get less food that has labels on it, right? When we get more whole foods and we know how to cook for ourselves and we can prepare meals for our family and when we eat together as a family, we eat healthier food and we are healthier people. And so I think that that's so important to bring back into middle school and high school education, because that's so critical to our overall health. And it's so deep because people don't have the time and then they're just grabbing food. And then that food, of course, has all sorts of things in it that aren't as good for us. So nutrition is really quite simple. And I think that in some ways, it's complicated, but simple. What we've learned over these past 10, 20, 30 years, right, is just as we went away from whole foods, we saw so much more disease. And so it just reiterates the importance of going back to whole foods and how important that is to get all the nutrients, vitamins, minerals, and phytonutrients that our body needs to stay healthy. So I think that's really important. I get so excited when my kids are now 23 and 21. We have like our group family chat, and then they'll send pictures of the dinner they just made. And it's just so fun to see because it's beautifully made and it has lots of vegetables and stuff. I really have to give all the credit to my husband because he does most of the cooking in my family. And so really did all the teaching for them. But,
you taught him what to put on the plate, though. So it's
I did. I really helped him. I helped him somewhere. I don't know where, but somewhere.
I'm good at dishes. That's pretty much what I do.
Uh,
As we go towards the end of the podcast, I just want to ask you, we've covered a lot and we can just keep going in the same vein, but what is it like in the day of a functional medicine doctor? What is your typical patient? How do you approach them? Do you order labs, MRI? Everybody gets an MRI scan. What's it like in the day of a functional medicine doctor?
The most important thing that we talk about is gathering the patient's information. So gathering their history and looking at their timeline, understanding, when things happened. So you can try to get that sense of what that trigger was, what shifted the health of their body, right? Because as we talked about earlier, we want to ask that question, why? And sometimes it's hard to find the trigger. And many times there's multiple things coming together, but just spending that time to gather that history is the number one thing we do and the most important thing we do. And just thinking about things differently, I think, is what creates a functional medicine practice. But like yesterday, I had a patient who came to see me, and this was like her third follow-up, but she was a 50-year-old woman who for like 3 or 4 years had been dealing with these episodes where for like 15 seconds to a minute and a half, she would have these like blank episodes where she couldn't recall things. She couldn't sometimes even hear what somebody was saying to her. She couldn't focus. So of course there was a concern that something neurologically was going on, and she had a workup for epilepsy, and they didn't see any signs of seizure going on, but they did put her on some anti-epileptic medication, which didn't help her symptoms at all. And they ended up doing some evaluation and found that one of her carotid arteries was pretty blocked, and she was only 50 and a pretty healthy person. So they realized she had familial hypercholesterolemia, and then started to treat that and put a stent in. But that didn't help her symptoms either. So she came to see me, and she was still having these episodes where she would say her brain just shut down. And so, we shifted around her diet, and then did some testing on her. And I ended up testing her lead level, which, I often do. It's on a panel, a nutrient panel that I do, and it has a blood lead level on it. But a lot of times when people come in with neurological things, I'll do some heavy metals in the blood. And her blood lead level was 5, not crazy high, but because in the past we were letting blood leads of 10 be okay. Now we say less than 2 for our kids, but 5 is a little borderline. And so she realized, she tested her water, and her water had 6 times the amount of lead that was recommended in it. She had been living in this condo for the last 5 years, and these symptoms started 3 years ago. And she also had some digestive issues. She was having some digestive pain. She was having some bloating. She was having some anxiety. And what was amazing is when we found this lead, and she stopped drinking her water. She's in the process of getting that fixed at the present time, but she stopped consuming the water with the lead. And we started to do some things to help her body, mobilize lead, just in terms of better diet and some other things as well. But those symptoms just all went away. And I've seen her, this is probably over the last 4 or 5 months, her blood lead level is now normal. She's not having those episodes of brain freezing or whatever you want to call it. And her anxiety has improved, and her digestion has improved.
Wow.
And, we have to ask that question, why, and look upstream and try to figure out and recognize how all those symptoms in the body are interrelated. And so, I think that functional medicine has definitely gotten criticized in the past about over testing, right? So you're like, do you need to do all these tests? And it's a really good criticism to have, and to really say, okay, what can we do this without as many testing? And really, I think the thing that helps me the most when I'm working with patients is just taking the time to get that history and really think about how all their different systems in their body are interrelated, and thinking about their timeline.
Do patients that have polychronic diseases that come to you and are finally looking for just a different approach, and maybe give us some examples of patients that you've been able to, if so, been able to modify that direction they were taking towards end stage, heart failure or end stage kidney disease or whatever the road they were on, and how you could get them off of that path.
In terms of metabolic syndrome, right, we know that metabolic syndrome, insulin resistance, it's affecting prediabetes, right? It's at least half of adults in the US, and probably more. Some people are saying up to 80% of us are not metabolically healthy. But what we recognize is that when we have metabolic dysfunction or metabolic syndrome, that increases risk of vascular disease, dementia, Alzheimer's disease, but also increases risk of cancer. What we were talking about before in terms of increasing risk of depression, increasing risk of infertility, PCOS. And so often people come in with a whole bunch of things going on. And when we say, okay, when we look and we say, okay, you've got signs of metabolic syndrome, which is really easy to see, right? We see that high waist to hip ratio. We see their blood pressure starting to go up. We see the cholesterol being out of balance, right? That HDL being low and triglycerides high. When we see that pattern of metabolic syndrome, which it's very easy to identify, then we say, okay, the one thing we can do is work. We know we have to reverse this, right? We know we have to reverse this metabolic syndrome, whether it's cleaning up their diet, getting rid of the high fructose corn syrup, getting rid of the added sugars and refined carbs, getting them exercising, increasing their lean muscle mass. And then amazingly, right, people do so much better. Their blood pressure comes down. We don't need to increase the number of meds they're on. We can take away some medication often. Their cholesterol pattern improves beautifully. Sometimes mood improves, and if they're still cycling, for women, their periods improve. Their memory improves and their cognition improves. And so it's such an important area that we focus on. everybody should be focusing on this. And we see so much of it that there's always something you can do with every patient you have, that you can work on improving their insulin sensitivity and lowering their symptoms of metabolic syndrome, and therefore improving all aspects of their health, from their immune system function to the cancer risk to their vascular health. Absolutely.
Well, we could go on, and I've got about 20 more questions, but I think this has been an unbelievably inspiring conversation, Elizabeth. We thank you. And we have a tradition at the MTV Unscripted, and that's to ask our guests to put on their visionary hat and blue sky thinking. My takeaway from doing a little preparation, I'm sorry, and listening to your conversation is that this is about return to our natural design in a way, which I really believe in, right? Acute care medicine came up in the 1700s to cure disease, but we've gone too far. We've forgotten our natural design. And it's kind of what you folks in functional medicine really do, using nutrition and biochemistry. But when we do see, Lisa and I and John are involved with a lot of other things in healthcare, and we're seeing new primary care models start to adopt some of your teaching, functional medicine team. They are, and they're getting paid for outcomes rather than getting paid for just see the patient. So where do you see this going in the next 3 to 5 years in reality? Where do you see this unfolding in contemporary healthcare in America?
Yeah, I'm excited. I'm really hopeful and excited to see the integration of these processes and the way of thinking about our patients, asking that question why, looking for root cause, having the time to take with our patients. And because, as I said before, functional medicine is just good medicine, right? And it will help our patients do better with lower costs overall. So I'm excited to see that. We've seen it, as you said, an integration already, and I'm excited to see more of an integration.
Fantastic.
We're either had or going to have people like Bill Besterman, who's, published a lot in the Substack, of course, on optical medical therapy. And God bless those guys for, taking chronic disease and managing it to prevent some of the long-term downstream things that are going to happen, right? They're going to have heart surgery. They're going to have kidney transplants. They're going to have dialysis. But at functional medicine, the other extreme, taking people who were all born, other than the 3% or so with congenital abnormalities, for the most part, we're healthy people, and then we become unhealthy. And I think if I encapsulate functional medicine, is let's bring them back, to Steve's point, back to let the natural homeostatic mechanisms that evolved over millions of years of evolution to keep us healthy back on track, and to take us off that train that we're headed towards. But thank you so much for being with us today, Elizabeth. Really appreciate it. And Lisa and Steve, as always, thank you for joining the conversation. And Steve, I'll admonish you later for all the prep work you did. But I suspect we all do a little bit of prep. And the truth is, I think Steve's the only one who's honest and confesses to it.
He's an overachiever.
Yeah.
Thank you, Elizabeth, and thank you for the work you do.
You.
It's been fun to be with you all. Thank you for having me.
We want to take a minute now to introduce the new MTVA membership program. As a 501c3 nonprofit, we rely on support from our grassroots network to advance our mission of creating a value-based health system with high-quality patient outcomes at a reasonable cost. As we continue to grow and broaden our impact, we're excited to invite like-minded organizations and individuals to join our membership program. We're proud to offer 2 membership models, Ally Member and Trade Member. Tax-deductible membership contributions help us enrich the healthcare environment with quality content, including this podcast, and robust platforms to fuel discussion, collaboration, and advocacy that lead to groundbreaking solutions. For more information, including a full list of benefits offered, visit our website at www.movingtovalue.org/trade-member. The link is also in the episode description. Thanks again for listening and for being part of this important movement.